Sanctuary Day Program LLC operates under a strict, zero-tolerance policy for mistreatment, abuse, neglect, and exploitation, mandated oversight. These policies protect a specific demographic, at-risk adults with intellectual and developmental disabilities. Legally, the designation of an at-risk adult requires meeting specific thresholds. The first is chronological. The individual must be 18 years of age or older. This logic tree defines the at-risk adult criteria. The sequence begins at 18 or older and then splits into two operational conditions. The individual is either unable to obtain necessary services for their health and safety, or they lack the capacity to make responsible decisions. Minors receiving services fall under parallel state protections governing child welfare. Protecting this population demands three exact operational competencies: mastering the legal definitions of abuse, executing mandatory reporting without hesitation, and maintaining continuous environmental monitoring. Before any direct care provider can identify or stop an instance of abuse, they must first grasp exactly what the law considers abusive. Subjective intuition is insufficient. Legal precision is required. The acronym MAIN categorizes the specific threats we monitor. These definitions encompass both the active infliction of harm and severe failures to act. Physical abuse extends beyond the direct infliction of bodily pain or injury. It explicitly includes the imposition of unreasonable confinement or restraint against an individual. Sexual abuse covers any non-consensual sexual contact. By definition, any sexual interaction between an employee or contractor and an individual receiving services constitutes sexual abuse. Caretaker neglect addresses severe operational failures, categorized by both acts of omission and commission. Omission occurs when a caretaker fails to secure or provide necessities in a timely manner. This includes adequate food, shelter, psychological care, or required habilitation and medical treatment. Commission involves a caretaker knowingly using harassment, undue influence, or intimidation to create a fearful and hostile environment. Exploitation relies on deception or undue influence to deprive an at-risk individual of their property, assets, or anything of value, either temporarily or permanently. The law also recognizes self-neglect, where an adult substantially endangers their own life by failing to obtain necessary services. However, there are strict exclusions to this definition. A lifestyle choice or the refusal of medical treatment in accordance with a valid medical directive or palliative care plan does not constitute self-neglect. Categorizing these behaviors translates MAIN from a subjective feeling of mistreatment into a rigid set of objective, actionable compliance breaches. When dealing with minors, the legal framework mandates that all staff and contractors act as mandatory reporters for suspected child abuse and neglect. Indicators can be physical, like fading bruises noticeable after an absence from school, or emotional, presenting as extreme passivity or shrinking back at the approach of adults. Neglect often manifests materially. A child might repeatedly hoard food, steal, or consistently wear clothing inadequate for the weather. The identification of child sex trafficking relies on identifying specific, modern indicators that differ from traditional neglect or abuse. Unexplained material items often signal a trafficking situation. A youth possessing large sums of money, multiple cell phones, or exhibiting signs of being controlled by an older associate requires immediate intervention. When any form of this maltreatment is caused specifically by the employees of the caregiving facility itself, it is classified as institutional abuse. Recognizing these subtle, non-obvious behavioral indicators allows for the interruption of systemic failures within a care facility. A common professional error is the belief that disclosing suspected abuse to a supervisor fulfills the legal obligation of a mandatory reporter. In Colorado, relying solely on an internal reporting process is illegal and constitutes a Class 3 misdemeanor. The law dictates a dual reporting mandate. The external pathway requires immediate reporting to law enforcement and protective services. Concurrently, the internal pathway requires notifying the director, who has 24 hours to alert the case management agency and legally authorized representative. Immediately, the physical safety of the individual must be secured. This means removing the victim from the abusive setting or replacing the suspected staff members. Direct care staff must then initiate victim support. This involves monitoring their behaviors for distress, reassuring them, and offering external crisis counseling resources. Following the incident report, the director or a neutral designee launches an internal serious incident investigation. This internal investigator focuses on analyzing operational failures and determining contributing factors. They must defer the actual criminal investigation entirely to law enforcement. Finally, all completed internal investigations are submitted via the case management agency to the Human Rights Committee for independent review. Separating external law enforcement from internal administrative review creates a check against organizational bias. This structure ensures that an independent legal authority reviews every allegation, even as the agency conducts its own operational follow-up. Effective protection requires shifting focus from reactive incident reporting toward a proactive strategy of continuous environmental monitoring. Detecting the early signs of Maine requires a rigid, scheduled system of internal audits deployed across all agency programs. For non-residential programs, this means completing one comprehensive review of program operations every quarter. These can be announced or unannounced. Residential settings face stricter timelines. The process begins with an essential pre-move-in inspection, completed before an individual ever takes placement. Look at this residential monitoring schedule. Once placed, standard requirement mandates monitoring visits occur at least once per month. The director can conditionally reduce these visits to a quarterly schedule if the service model and a history of strict compliance justify it. During these audits, inspectors verify specific physical targets. They check for HUD and ADA compliance, overall cleanliness, and the operational status of safety equipment like smoke and carbon monoxide detectors. They also scrutinize operational targets, reviewing medication logs, verifying physician orders, and evaluating emergency disaster plans. In cases where the agency manages an individual's money, personal needs audits are executed quarterly to verify financial integrity. Protecting this vulnerable, at-risk population is an active, relentless pursuit by dedicated care providers. It is never a passive status. Comprehensive compliance shifts focus from reactive incident response to actively engineering an environment where mistreatment is identified and interrupted before it takes root.